George, congratulations on winning the 100 most impactful leaders in healthcare, and big congratulations to the entire Jaslok team. And can you tell me how are you feeling about winning this award, and tell us more about this awards?
Look, so this, I'm a very small piece in this huge family of Jaslok. But yes, I believe that yes, I'm sure we have been able to create an impact in the last 2 years or 3 years of my stint with Jaslok. And we all believe that if we work as one team, because one man alone cannot make a difference. So it's a collective effort of the team who's been working with my entire team, entire marketing team, and Jaslok, the 17 people who work with us. And not only them, but the entire the administration team, the medical team, as well as the nursing staff. We all put together an effort, and I think that had some impact and bearing on the whole thing. So I'm excited to receive this award on behalf of all. It feels good when you receive it, when your work is appreciated, your work is acknowledged, and you get such awards in a forum like this. It really feels good.
You're actually working for a very respected brand in Mumbai, Jaslok Hospital, and it's a very reputed healthcare establishment. Can you please tell us and share with us, like when you joined Jaslok, what was the challenges and what strategies have you made to transform this place?
So Jaslok is an iconic brand. It's an iconic healthcare brand, an iconic hospital. It's a heritage hospital. It was established way back in the 70s when there were very few hospitals in the country. Few hospitals of Jaslok stretcher. Was inaugurated by the Prime Minister Indira Gandhi. So, as a hospital, Jaslok didn't need much of intervention as far as marketing is concerned. So that's my domain. But I'm a firm believer of a thing that no matter how big a brand is, you have to put it up into public domain and let people know what the brand stands for, the ethos of the brand. What are the brand promise? And our promise of the brand was patient first. The best clinicians working on the patient, the best equipment in the hospital, and that's what we all believed in. So my job was cut out where we wanted to let people know it's not an old hospital which is known only for the clinical expertise, but that we are a modern hospital with a modern approach, and we have also progressed with time. So the challenges were very clearly communication and to break away from the clutter of the new age hospitals who tom-tom about their facility, about the infrastructure, about their equipment. So we all had all that just. So the very fact we had everything with us, and the best clinician, the best management, and the best set of trustees who were backing the hospital to take it to such a high and put it up in the public domain was the only thing to be done, and we successfully did that. As far as the strategies were concerned, we ensured that we wanted to reach out to the consumers rather than consumer reaching out to us, because the times have changed. Jaslok, when they worked in that environment earlier, it was more of consumers coming to the hospital, fetching for information, looking for information, and trying to reach out to hospitals. Now I think the times have changed, where the hospitals also have a responsibility of spreading awareness, reaching out to consumers themselves so that they are aware, reaching out to patients and their caregivers, and letting them know what the hospital stands for, and giving them the reassurance that they are in safe hands. And that's what we did. So the strategy was very clear, looking at all possible channels, right? Whether it is the corporates, whether it is international, whether it is your trade marketing, the GP marketing, where we go and tell the GP what we do and what are we best at. And also especially the digital space, engaging with media and communications and all. So this was the strategy that we would like to engage more with consumers and let them know about our, yes, a little bit of tweaking in terms of how we function, in terms of creating packages for patients so that it is easy on their pocket, making healthcare affordable was a sort of strategy, and we were pretty successful.
Recently, we saw a very interesting campaign about a world-renowned liver transplant surgeon who came from Ireland.
He was from Delhi.
So, Jaslok has been serving the domestic community. So, how are you going to the next level, treating international patients, making Jaslok as a global brand? What are your initiatives on that?
Right. So, as we speak, Jaslok is currently is serving a good percentage of international patients. Every year, we service around 15 to 20% of our patients are international patients. And Jaslok is a international brand, not only in Middle East but in Africa as well. So these two regions see a lot of patients who entrust their lives with Jaslok because they've been doing it for the past so many decades. yes, having said so, there are other parts of the world that we would like to reach out to, which are like the Asian market, the SAARC countries, and strengthen our presence in the Middle East and in Africa, which we are doing. We are investing in terms of our communication centers in these places, so that it makes more sense for people to engage with us directly rather than coming through facilitators and towns who would misguide patients. So that's what the endeavor is. As far as the world-renowned Dr. Soin is concerned, Jaslok has always believed in getting the best. Whether it is the equipment, like if I can boast of my equipment. When we bought the equipment, we were the first in the country, probably in one of the cases we were first in Asia to buy or acquire that equipment. All that we did because we always believed that we need nothing but the best, right, for our customers and for our doctors, so that they can perform better. So when we were looking at the liver transplant program, which by the way we were the first hospital in Western region to start liver transplant. So we're the first hospital. So we have done it all, but we wanted a better set of doctors to provide that next level of care, next level of surgery, next level of liver transplant and the life after for our patients. And that's why we got in the best. Dr. Soin is one of the best in the country. He's world renowned. He works out of Delhi. He extended his services at Jaslok. And our endeavor is that we want to make Jaslok as one of the finest center of excellence as far as liver is concerned.
So quick view on your say on the Indian hospital scenario. Can you tell us like what needs to be done, how this industry needs to transform to come up on the map or to be a global healthcare destination? Your say on what India should be doing, what Indian healthcare and hospital players should be doing to bring India on the forefront.
Look, so India is already there on the global map for sure. India is the preferred destination as far as most of the healthcare or medical tourism is concerned. So yes, there's a lot of mountains to climb. It's not easy because the most important thing which keeps India away or maybe from the #1 spot just now is the quality of healthcare, which can get better. We have to work very hard on the quality of healthcare. When I say quality of healthcare, maybe the clinical quality of healthcare is being provided to them, but maybe the softer aspect of health, which is the experience of the customer, which is not necessarily the patient, but the caregiver who are coming along with the patients. So the patients are well taken care of by our doctors and our nurses and our administrative staffs, but their requirements are very, very small. That's why we are able to meet them. But as far as customers are concerned, who are people who are coming along with the patient, the family, probably the friends or their relatives or their or a doctor from those markets or from those countries, they need to feel at home. They need to get a good experience. They should feel better about them making a choice of coming to India for a medical treatment. So I think that's one aspect, and second is making it a little affordable. When I say yes, cost is a big factor. When we treat such patients, obviously there are a lot of frills which are attached, and those frills obviously they don't come as cheap. They have to be paid for. So it's a different kind of a catch-22 situation for a hospital. If they bring down the cost, they are not able to provide the frills. But if they provide no frills, obviously India as a destination is not the preferred destination, because they look at Thailand, they look at other Southeast Asian markets, because there are a lot of frills. So I firmly believe India has been able to provide medical treatment, but as far as medical tourism is concerned, we have not been able to even scratch the iceberg or the tip of the iceberg, because we never looked at patients as tourists. We look at them as patients, then we need to treat them and and make them well, and so that they can go back. But I feel if a person when we're talking about medical tourism, the tourism aspect of medical tourism is missing in the country. We are looking at providing the medical treatment, but doing nothing about the tourism. So that's where we want, as a hospital, we want partners. When we look at partners, we not only want partners who can get us patients, but partners who can take the responsibility of providing the tourism aspect of medical tourism for the patient. Whether it is giving them a post treatment tour of the city, or maybe a region, sending them to Goa, taking a package, or when the package is made, looking at requirement basis their pocket, creating interesting packages for them. So that is one aspect which can surely be looked at.
Thank you, George. Thank you for talking to us, and it was very lovely spending time with you. And we wish that you win more such awards in life. And a big congratulations to Team Jaslok again.
Thank you very much.
Thank you very much. Thanks.